Assalamualaikum warahmatullahi wabarakatuh. A very good day to our panels. Allowing us to introduce ourselves first. My name is Sahira Binti Dolkefli. Together with my partner Aina Nabilah Binti Hamdan Dahari, we are going to present our research study, knowledge, attitude and perception of air pollution in Malaysia during COVID-19 pandemic, supervised by Dr. Shawal, Sahid, Hamid and Hussain. Okay, for the research background, according to Perlia and Huang 2019, stated the air pollution become the fifth highest mortality risk factor globally, and it can be proven in which 91% of the population around the world are exposed to unhealthy level of air quality, while only 8.7% are exposed to healthy air. In addition, since the outbreak of COVID-19 pandemic, the government around the world implemented lockdown and movement restriction to prevent the widespread of viruses that make people need to adapt with a new norm such as stay at home. With these changes, it lead to less traffic on the road, cause the decreases in anthropogenic activity, brings to the reduction in primary emissions such as nitrogen dioxide and secondary pollutant, for example, particulate matter PM2.5 and ozone.
Next, I will explain about the problem statement. According to the World Health Organization, the air pollution caused approximately 7 million premature deaths, most due to the increased mortality from stroke, heart disease, chronic obstructive pulmonary disease, lung cancer, and acute respiratory infection. With the rapid increase in the vehicle on the road caused by the massive emission of the carbon monoxide in the air, in the least developed countries such as the Bangladesh, Pakistan, India, Mongolia, and Afghanistan, they suffer from the severe air pollution because of the PM2.5 concentration are already beyond the standard of the level set by the World Health Organization. It can be proven at the Dhaka, Bangladesh, the average PM2.5 concentration in Dhaka air quality recorded was the 83.3 microgram per cubic meter in 2019 and became the second highest city after the Delhi, India, suffer from the severe air pollution. In addition, according to the Velvet and Mayer 2020, the pandemic of COVID-19 was declared as a global health emergency in 2020 by the World Health Organization since it is widely spread throughout the continent. Besides that, since the COVID-19 virus became the newly infection disease, the number of infecting people day by day rapidly increased and it also caused the death across to the country. Now, we move to the research question and research objective. For the research question, it consists of four, which is first, is there any relationship between the knowledge that influencing the air pollution during the COVID-19 pandemic in Malaysia? Second, what is the relationship between the pupil attitude towards the air pollution during the COVID-19 in Malaysia? Third, what is the relationship between the pupil attitude towards the air pollution during the COVID-19 in Malaysia? And then lastly is, which the independent variable has a more influencing with the dependent variable. For the research objective, first is to examine the relationship between the knowledge and air pollution during the pandemic of COVID-19 in Malaysia. Second, to examine the relationship between the people's attitude towards air pollution during the pandemic COVID-19 in Malaysia. Third is to examine the relationship between the people perception towards the air pollution during the COVID-19 pandemic in Malaysia. And lastly is to identify between the knowledge, attitude, and people perception that have a strong influence on the air pollution during the COVID-19 pandemic in Malaysia.
Okay, for the conceptual framework, so this is the conceptual framework for our research. The independent variables for our research are knowledge, attitude, and perception. Meanwhile, the dependent variable is air pollution. Okay, for the next part, hypothesis development. There are three independent variables that consist of two hypotheses for each variable. For null hypothesis, there is no relationship between independent variable and dependent variable. Meanwhile, for alternative hypothesis, there is a relationship between independent variable and dependent variable.
Next, methodology that we use is the quantitative method, which is a cross-sectional survey for our research design. For the unit analysis, we focus on the people in the Malaysia who are aware the changes in the air pollution before and during the pandemic of COVID-19. The sample size of the study was the 251 respondents because based on the Cook State and Ong 2019, the sample size more than 200 are preferable. And we use the Likert scale for our data measurement. We use the convenience sampling as our sampling technique among the Malaysian people who are aware about the air pollution during the pandemic of COVID-19. For the data collection, we use the questionnaire which consists of 5 parts, which is Section A is the profile of respondent, Section B, knowledge, Section C, people's attitude, Section D, people's perception, and lastly, Section E is the air pollution. For the last research methodology data analysis, we use for the study is the test of normality, reliability analysis, Pearson correlation, and multiple regression. Next is a finding. Here is the demographic profile. It is to analyze the profile of the respondent. As we can see here, the majority respondent is coming from the female respondent with the 68.1% with the frequency 171, while the male respondent is the 30.9% with the frequency is 80. The age between the 18 until 28 years old was the higher percentage of the 18.9% with the frequency 203. The age between the 29 until 39 years old was the second highest percentage of 10.4% with the 26 respondents, and the last age between the 40 until 15 years old were 8.8% with the frequency 22. The highest of the academic qualification of the respondent is degree at 62.5% and the frequency is the 157. Diploma is the second higher with the 24.3% and 61 frequency. SPM was third highest with the 8.4% and 21 respondents, and the others academic qualification is a 4.8% with the 12 respondents. For the employment sector, the student has a higher percentage of the 59.8% with the frequency 150, while the private sector has the 17.1% with the frequency 40. Third highest is the government sector is the 50.9% with the 40 frequency. The employment sector was the 5.8% with the frequency is 13, and lastly in the self-employment is the 2.0% with the 5 frequency. Lastly, the majority place of the current living area of the respondent is semi-urban with a higher percentage at the 53.0% with the frequency 133, while the second highest is the urban with the 37.8% and frequency is 95, and lastly is the rural area where the 9.2% with the frequency is 23.
Okay, for the next part, main finding. For the first objective, to examine the relationship between knowledge and air pollution during COVID-19 pandemic in Malaysia. For the analysis being used, Pearson correlation. For the result, R equal to 0.451 and p-value 0.000. For the hypothesis, accept the HA1 and reject the HO1. Okay, for the second objective, to examine the relationship between people's attitude towards air pollution during COVID-19 pandemic in Malaysia. For the analysis, Pearson correlation. For the result, R equal to 0.580 and p-value 0.000. For the hypothesis, accepted HA2 and rejected HO2. For the third objective, to examine the relationship between people perception toward air pollution during COVID-19 pandemic in Malaysia. For the analysis, present correlation for the result are equal to 0.603 and p-value equal to 0.000. For the hypothesis, accepted HA3 and rejected HO3. For the fourth objective, to identify between the knowledge, people attitude and people perception have strong influence on air pollution during pandemic COVID-19 in Malaysia. For the analysis, multiply regression. For the result, R square equal to 0.397. For the knowledge, beta equal to 0.053, p-value 0.426. For attitude, beta 0.271 and p-value 0.001. For the perception, beta 0.371 and p-value 0.000. For the hypothesis, people attitude and people perception was the strongest influence rather than knowledge of air pollution during COVID-19 pandemic. For the research recommendation, first point is encourage to use a clean energy and renewable fuel production. The government can adopt the method from Shenzhen, China, that switch the public transport power diesel to electric bus that can reduce the carbon dioxide emission and particulate matter. For the second recommendation, encourage to improve ventilator. The needs to improve the ventilator system in the household can help in reducing the carbon dioxide emission and particulate matter because the use of windows and doors can encourage to ensure in reducing chemical substances at home such as indoor cooking and burning mosquito oil. For the third recommendation, change the way to channel information related to air pollution situation. To ensure the public keep updating the current situation of air pollution in Malaysia, the government can change the method to channel the information. It is because with the investment of technology, the information can spread quickly and the public can get access to the information. For the fourth recommendation is strengthen public communication. Through public communication, the information will be exchanged through television, radio, newspaper or social media as the main platform to channel the information about the air pollution in a country. For the last research recommendation is advancing the policy of pollution. It will ensure that irresponsible parties can be subject to the legal aspect based on their action.
For the next part is the research limitation. First is the limited sample. Even though the study can answer by people over 18 years old and above in Malaysia that know about the situation of the air pollution during the pandemic of the COVID-19, the sample study is only 251 respondents to answer the survey. With the limited sample of this research, the result do not cover all the factors that influence the air pollution during the pandemic of the COVID-19. For the future recommendation, the researchers should use the last sample to collect the data because the ongoing COVID-19 pandemic still pose and treat people. Second, the limited model. Under this study was the lab variable in which the only 3 independent variable and 1 dependent variable. The future study can add the impact of the COVID-19 pandemic to the air pollution in Malaysia. Last is the disadvantage of the quantitative study. Due to the process of the data collection not deep as the much of the qualitative study, it is because the quantitative study has a limited result. The study was unable to know how deep the understanding based on the respondent perspective about the need to reduce the air pollution during the pandemic of the COVID-19 that helped the environment to recover back. The future research should conduct the interview session with the respondent to ensure the data collection is more accurate and useful other than using the questionnaire method. For the conclusion, The research can gain and help the better understanding about the relation of the air pollution during the pandemic of the COVID-19 from the aspect of the knowledge, attitude and perception among the Malaysians. It also contributes in giving the new knowledge to the related parties such as the Department of Environment in Malaysia and community in Malaysia in ensuring the air pollution can be reduced. That's all from us. Thank you.